Good afternoon. I myself, Dr. KUMAR JAISWAL, Professor and HOD, Ophthalmology, BRD Medical College, Gorakhpur. My topic is prevalence of refractive error induced amblyopia presented in a tertiary care teaching hospital. Childhood visual impairment due to the uncorrected refractive error is one of the most common problem in school-age children and is the second leading cause of treatable blindness. Uncorrected refractive errors are responsible for up to 40% of the cases of the visual impairment worldwide and remain prevalent even in high income countries. Approximately 12.8% million children in the age group 5 to 15 or 16 years are visually impaired from uncorrected or inadequately corrected refractive errors, estimating a global prevalence of 0.96%. And AIOCMTC1 must be addressed to prevent development of the amblyopia. The material methods is the present study is descriptive cross-sectional conducted from July 21 to July 22 in a tertiary care center. Patients were divided in 4 age groups, that is 5 to 7 years, 8 to 10 years, 11 to 13 years, 14 to 16 years. A thorough history was taken regarding asthenopic symptoms, previous history of ocular diseases, including history of the wearing of the glasses. The children were then enrolled after taking consents from the parents and underwent visual acuity assessment, objective diffraction using autorefractometer followed by cyclopentolate 1% cycloplegic stick retinoscopy. These children were then categorized according to the type of refractive error after post-mydriatic examinations. The inclusion criteria is children between 5 to 16 years of age diagnosed with refractive errors. Exclusion criteria is children of the less than 5 years of age and the children having any other associated disease of ocular structures. The C-square test was used to analyze differences in the refractive errors. This table shows the distribution of children according to age. In between the 5 to 7 years, that is 17.9%, 8 to 10 years, 21.2%, 11 to 13 years, 26%, and the highest is in the age group of the 14 to 16 years, 34.9%. And this table shows distribution of children according to the sex. In the male, this is the 54%, and in female, this is 46%. And this shows the distribution of children according to the visual acuity. In the 6x6, UCVA is 79%, while BCVA about 96.9%. In 6x9 to 6x12 group, UCVA 13.3% and the BCVA 2.5%. In 1618 to 660 is UCVA 5.3% and the BCVA 0.5%, and less than 660 in the UCVA 2.4% and the BCVA 0.1%. This table shows prevalence of refractive error by the age. In age group 5 to 7, the percentage is 18%, 8 to 10%. In age group 8 to 10, this is 19.1%. In age group 11 to 13, this is 21.5%. And age group 14 to 16, this is 13.4%. That is the highest percentage. This table shows prevalence of refractive errors by the sex. In the male, this is 19.1%, female 16.4%. And this shows the association of age to the refractive errors. In age group 5 to 7 years, simple myopia 1.8%, simple hypermetropia 9.8%, myopic astigmatism 0.5%, hypermetropic astigmatism 1.5%, mixed astigmatism 4.4%. In age group 8 to 10, this is simple myopia 8.3, simple hypermetropia 8.8, myopic astigmatism 1.4, hypermetropic astigmatism 1%, and the mixed astigmatism 3.3. In the age group of 11 to 13, simple myopia 18.6, simple hypermetropia 7.7, myopic astigmatism 2.1, hypermetropic astigmatism 0.5, while mixed astigmatism 2.3. In the age group 14 to 16, that is simple myopia is highest in the 25.8%, simple hypermetropia 1.5%, myopic astigmatism 2.3, while hypermetropia 0 and mixed astigmatism 0.8%. And this table, this graph shows myopia increase with the age and the hypermetropia decrease with the age group. And this table shows association of sex to the refractive errors. Males in the simple myopia 26%, simple hypermetropia 20.3%, myopic astigmatism 3.1, hypermetropic astigmatism 1.8, mixed astigmatism 5.2%, while in the female group, the simple myopia 19.3, simple hypermetropia 14.7, myopic astigmatism 2.6, hypermetropic astigmatism 1.3, while mixed astigmatism 5.7. Discussion: the prevalence of the refractive error in this study was 17.9%, which was much higher when compared to the other observed by the GVS Murthy et al., New 6.4%, while similar study from different parts of the world showed a prevalence of 8.2% in Baltimore, USA, and the 12.8% in Sunni district in China, 2.9% in Nepal, 15.8% in Chile. There was a significant difference in the prevalence of refractive error with advancing age from 18 to 30.4%. Our results were comparable with the study conducted by Varal et al. In Devangiri. A study conducted in the Ahmedabad city showed that the prevalence of refractive error was highest 40% in the 16 years old. There was no significant difference in the prevalence of refractive error between the males and females in our study. This was similar to the result shown by Ande Vyar et al. In Andhra Pradesh and Krishnan B.M. et al. In Vilupuram, Puducherry, where no sex predilection refractive error was noted. Hassan et al. Was found that myopia 63.5% was the most common type of refractive error, followed by hypermetropia, astigmatism, which is similar to the result of our study. There was no significant difference in the prevalence of myopia, hypermetropia, and astigmatism between the males and females in our study, similar to the study conducted in the Vilupuram, Puducherry. In our study, 68, that is a 3.1% student suffered from amblyopia. It was common in children with visual acuity between 6/9 to 6/12, which is similar to the study by the Menon et al. Conducted in the RP Center in the AIMS. Conclusion take-home message is that amblyopia is one of the most common cause of impairment in the both children and adults, with a prevalence varying between 0.2% and 12% depending on the subset of the population studied. Severe amblyopia is also considered a significant risk factor for blindness in case an individual loses sight in the fellow eye. Amblyopia increases the chances of blindness in the healthy eye, mostly from the trauma. Timely diagnosis and treatment is likely to reduce the prevalence of amblyopia, as has been seen in many countries that have taken up mass education, visual screening as important community aids to increase knowledge and awareness about the condition. Thank you.